Hey, how's it going? Today, I'm answering questions about how to get through Princess Weekend with an injury.
This is Running to the Castle, a podcast for injury-prone Run Disney runners on a journey to running magical miles. Join me, Dr. Allie, as I share the secrets I've gathered as a runner, doctor of physical therapy, and coach. You'll learn the exact ways I get my clients to the castle strong without feeling broken or held together with KT tape as they cross the finish line.
So, at the time of recording this, Princess is in just a couple of weeks. When this comes out, Princess will be about 9 to 10 days out. So, take this information with a grain of salt because it may not apply to everybody by the time it actually comes out, but these are the questions that are coming up now. I'm seeing them now. Hopefully this information will help you in future races if it can't help you right now for Princess. So I have been getting lots of DMs asking questions about foot pain, hamstring strains, IT band syndrome, posterior shin splints. And I'm also seeing questions in the Facebook groups come up about gearing up for Princess Half. I've been derailed with some pain. What do I do? So, in these next couple of episodes, you're going to hear what I would do if my client came to me with this information or if I had this problem myself. Remember, please seek actual medical advice from your physical therapist or your healthcare provider because I only have so much information and I am not examining these people. I am making my best general guess and assessment based on the limited information I have. So there may be more questions than answers in here, but this is how I start going through things when something pops up with me or when a client comes to me with some pains, aches, problems, and we're coming up on a race weekend. Okay, so this first one I saw in a Facebook group, and I'm going to give the gist of it. It is pretty long. This person is doing the Princess Half. They have some pain in their left lower butt and hamstrings since January 18th. That was the day that they did their 12.5-mile long run following the typical Run Disney Galloway training plan. The issue started 5 to 6 miles in, where the back of the leg is getting tighter and spasming. This person rested for 1 whole week and then tried to get back to shorter runs about a 5K distance. The pain was no better. Saw a doctor friend and they ruled out certain problems and said it was most likely bursitis, ischial bursitis to be exact. The ischial tuberosity is what you sit on. If you put your hands underneath your butt cheeks, your ischial tuberosities are those sits bones. Your hamstrings, your proximal hamstrings attach at those bones. And anytime you have a bony prominence like that, where it sticks out, like at your elbows, at the sides of your hips, the front of your knees, those butt cheek bones, you have a bursa. It adds an extra layer of cushion. They're fluid-filled sacs to add an extra layer of cushion to protect those bones. Imagine a partially filled water balloon sitting over any bit of bone that sticks out on you. When those bursa, those fluid-filled sacs, get irritated either by overtraining or a muscle trying to literally pull off the bone and irritating that bursa, inflammation goes inside of that bursa. So it swells, it gets inflamed. Anytime you see that itis, I-T-I-S, that means that's an acute inflammatory reaction. Now, sometimes we use the word itis, the ending, the suffix itis, incorrectly, but it is literally used for an acute inflammation. So bursitis is an acute inflammation of the bursa sac there. So This person got a deep shot in that area, so that's likely a cortisone shot. They don't say that. Got it on Thursday. At the time of recording this episode, it's Sunday, so that's Thursday to Friday, Friday to Saturday. It's been 3 days, and today ran for the first time. Much better, but not perfect. This person has stretched before and after. They've soaked muscles, they've iced them, they've heated them, bought some foam rollers, doesn't know how to use it, slowed the pace down, which she doesn't want to do, or they don't want to do. I actually don't know if this is male or female. They don't want to do because they've worked so hard to build up this pace. They can't take NSAIDs because of stomach issues. So, wondering, the tightness is there for sure. Feel it behind the left leg, but not directly behind the knee. It's a bit further up. And then feel it tight on the hip a little bit. Came on around 2.5 miles today. I did speed up my pace though. Doctor said to try to build back up to 6 or so. And if I have pain, contact him and he'll re-look at the remaining pain areas and possibly get a booster shot to help if needed to address that. Are there other things I can do for this that I'm missing? Obviously, post-race, I will need to add in some specific strength work, but short term, to feel okay for the half, what would you do in my shoes to help set me up for success on February 23rd when I cross the starting line? Okay, there's a lot of information in here. I still have questions. So, first questions are, is this pain all of the time? Because that kind of situation gives us an idea, gives us, meaning physical therapists, healthcare providers, an idea of how acutely inflamed it is. If it's a type of pain that's happening at all times, at rest, or is disrupting sleep, like it's so painful, usually like a deep ache, like a toothache kind of ache, that means it's a deep inflammation. It's really inflamed and unlikely to go away in the next 2 weeks. I have no idea if that is this person's case. I'm guessing it's not because they said it is feeling better. And so if somebody were to have that type of pain, if I were to have that type of pain, I would definitely need more than just at-home remedies to get rid of this inflammation. So I'm going to assume that's not happening because this person is not talking about staying up late and not getting any sleep. They feel well enough to try and run. Says it's much better, but not perfect. Second questions are, you've iced and you've heated. How long and how often? One big mistake I see when somebody uses ice and heat is they aren't doing it enough. One time for 10 minutes is like putting a Band-Aid on an amputated foot. It's a nice try. It is not going to do anything. Inflammation, whether you use ice or heat, both have been shown to be helpful. They need to be done for at least 20 minutes. They need to be done regularly. So in the first couple of days, I recommend people use 5 times a day. And they need to be done daily for 14 days, 10 to 14 days. Err on the side of longer. So I have no idea how long this person has been using these pain relief techniques. It's great that they have started doing them. I also would recommend not bouncing around between the two. If it actually is bursitis, I do recommend bursitis responds really, really well to heat immediately followed by ice. Heat for 20 minutes. I like a moist heating pad. Moist does a better job than dry heat. Dry heat is fine if that's all you have, but moist heat does do better. I have seen in the clinic, I have seen when I was when I went through physical therapy school, we had to use each of the modalities and we learned how to make each one the best. Like one of those gel ice packs, if you put it in a pillowcase, the pillowcase is enough of a layer as opposed to putting a towel over it. Or a moist heat did better than dry heat, things like that. Anyway, but bursitis does really well. Moist heat for 20 minutes, immediately followed by cold. It creates a wave effect. What that means is you get a wave, an influx of blood flow to the area. So now all of your blood flow is bringing in all of these nutrients and fighter cells to help fight the inflammation. And then you immediately cool it down and get those nutrients and those fighter cells to stay put for a little while because it cools it down, constricts the blood flow, and makes all of that stuff stay in that area and work. So it does a really good job of helping with bursitis as opposed to just heat or ice alone for bursitis. We have no idea if this is bursitis. This could also be a muscle strain, a hamstring, a proximal muscle strain. Proximal tendon problems are very common in runners, especially sprinters. It usually happens because as you are moving through the sprint, the hamstring pulls and contracts and it can start pulling away from the bone, similar to shin splints. Shin splints is a different injury, different part of the body, but the same concept is happening where the muscle's actually starting to pull away from the bone. And that's why it hurts where it hurts, because it's up top at the attachment point in the butt. And then you can have pain that starts radiating down the hamstring because inflammation is setting in just in the whole area. And your muscles start spasming up because that's the only thing it knows how to do. Our muscles know how to activate. They actually don't even do a good job of relaxing. Relaxing a muscle is a completely separate process, usually brought on by you literally like brain get in on it. Let's everything relax and just let everything go limp. Or you have to activate the opposite muscle to get that one to relax. So muscles know how to activate. And when they sense pain and injury, they actually tighten up more as a protection mechanism. The muscle tightens up and spasms to protect the area because it can sense danger. If this is a proximal hamstring tear, it can sense that it's tearing more. And so it doesn't know what to do. So it kind of, contracts and spasms. And then it makes it feel like it's tight. Because it technically is, but not in the sense of lack of flexibility tight. It is protection tight. So stretching more will actually make that type of problem worse. So this is a good time to mention, this is why it's so important to get an accurate diagnosis from someone so that you know what is going on. Because stretching a pulled muscle, stretching a torn muscle, stretching a strained muscle, those are 3 different ways to say the same thing to varying degrees. Stretching that makes it worse because now you are just pulling that muscle off the bone more and more and more. And so then it's just going to tighten, tighten, tighten because it still senses all that problem in the area and thinks it needs to protect it. So stretching more will actually make this worse if that's the problem that's going on. Foam rolling is a great thing to do here. It's hard to do at the proximal hamstring because you have to roll your butt cheek. Getting a massage may be better because then somebody can actually get their hands in there, dig in there to release the tightness that it's sensing, relieve those pressure points, relieve those muscle knots, and massage brings blood flow to the area. So if it's a partial tear or just pulled and started pulling off the bone but didn't actually do any tearing, bringing blood flow into the area will help secure it down. So a massage could be helpful. Now, too much massage goes overboard, so you need to make sure that it's comfortable. Another thing, this person got a cortisone injection. Cortisone injection takes 2 weeks to take effect. So we just haven't given it enough time yet. It usually feels better in the first 36 hours because they give you a numbing agent at the same time. And so that makes it feel better. And then day 3 or 4 tends to feel a little worse. And so you think, oh crap, it didn't work because it hurts worse. Well, no, it's just the anesthetic wore off. And so now you're feeling like somebody jabbed you with a really long needle because they did. And so it's going to be sore. But for that cortisone to actually take effect, it takes 10 to 14 days. And you usually aren't supposed to do significant running during that time because you want that cortisone to stay in that area. Now, it's not floating all around your body. That's not how the shot works, but it does better when you do gentle movement and gentle activities. So if this were me, I would stop stretching. I would use heat followed by ice daily, as many times a day as I could. There's really no upper limit on that, as long as you're not burning yourself either with heat or giving yourself an ice burn. I would foam roll, and I'd get in to see a massage therapist at least twice in the next 2 weeks. Since you can't take anti-inflammatories, that's okay because they got a cortisone injection. But like I said, I'd stop stretching. To prevent this in the future, this is one of the big reasons, not the only reason, but one of the big reasons why long miles should be slow, because I don't know this person's history. I have no idea if they've ever done a 12.5-mile long run before. This could have been their first ever, and they've done it at a good pace. They said that they've been working for that pace for months now. We don't like to change two variables. You should not change two variables at once. That's why long runs, when you're adding distance, should be slow. So you change just the distance. And working on doing speed separately so that you can work on the speed separately, but not overtrain the muscles. This is also the exact reason why I make my training plans different than the traditional runDisney training plan that Jeff Galloway has. Jeff Galloway's plan could be fine for experienced runners. Many of the runDisney runners are not that experienced. The ones that I talk to, they have started running in the past 5, 6, 7 years, and they run it for fun because they enjoy Disney. Now, of course, that's not every runner, but also these training plans, like I said, they could be good for experienced runners, but they are not good for injury-prone runners. So I also don't know this person's history. Have they ever had an injury before? The 12.5-mile long run a couple of weeks before race day is too much. If you have downloaded one of my free training plans, you know that for the half or the 2-course challenge, the longest distance in my training plans is 10 miles. And that is for a reason, because when we're injury prone, our bodies can't handle all of that extra mileage and so close to race day. If this happened on race day, well, they would have finished the race. Yeah, maybe it wouldn't have been the most comfortable, but now they wouldn't be worried about finishing the race in 2 weeks. They wouldn't be worried for a whole month, since this happened on January 18th, a whole month before race day. They could take all of the time to rest if they needed to. Now, you know my feelings on complete rest versus active rest, but I mean, at least be able to calm down the worry, because yes, could it happen on race day? Absolutely. Anything can happen on race day. If you prepare well enough, we significantly diminish those potential problems. But if this happened to this person on race day, they wouldn't be going out and trying the 5K. They could give the actual recommended amount of diligent active recovery time to let this heal without over aggravating it and feel better for whatever the next race is, whether it be Springtime Surprise, Chills and Thrills, or the Halloween Half, something like that. So this is why I make my training plans not have this amount of distance in it. It is a recipe for disaster for injury prone runners, but you don't know what you don't know. So we can't go backward and change things. We can only move forward. So I say that information because I have gotten questions why I don't have this much mileage in my training plans. And this is one of these reasons, because I cater toward injury prone runners, and injury prone runners should not be adding that much mileage that close to race day. It is too much, it's too straining, and then it takes 1 to 3 months to heal from it. And you just don't have the time when it's only 1 month away from race day. Thank you so much for listening. These next couple of episodes, I will be sharing other information just like this. If you have a specific question that you want answered here on the podcast, please let me know. Send me a DM, runDisney DPT on Instagram. For the runners that want to finish their next Run Disney race stronger and faster, so you stop getting injured, you beat the balloon ladies, and you cross the finish line, I invite you to check out my newest program, Stronger, Faster, Finisher. Get the workouts you need to build speed, stamina, and strength. If that sounds like something you're looking for your next race, visit the link in the show notes to learn more. As always, thanks so much for listening. That's all for now. Talk to you soon.